for China because, you know, the president from time to time has praised China, and we point that out. But the president on January 24th says, I want to thank President Xi on behalf of the American people. It's the president who has time and again defended China, praised China throughout this entire crisis. And yes, of course, we're going to read some of these tweets back to him to get his comment on it when he himself is the one in the briefing room or in the Rose Garden today blaming the WHO's, flat-footedness and all of this on their somehow devotion to China. So a lot of this doesn't add up. This is a president who has run out of explanations for his own failings, and we saw this time and again today, moving from one scapegoat to the next. He is trying to find a scapegoat and not really looking in the mirror.
And in news just to hand, the UN chief Antonio Guterres has just said that now is not the time to reduce resources for the WHO. The death toll in the US has surpassed 25,000, with 10,000 of those in New York City. Hanging over this announcement has been an escalating battle between President Trump and state governors. The president said he has the ultimate authority to lift state lockdowns, which he does not. The governor of New York, Andrew Cuomo, responded saying the president is spoiling for a fight, but said he wouldn't give him one. President Trump now says he is authorising governors to make their own decisions about when to lift lockdowns and reopen, something they already have the authority to do. Globally, the number of cases is closing in on 2 million, with 125,000 deaths. The WHO says the number of cases is easing in some parts of Europe, but outbreaks are still growing in other parts of the world. Italy has seen the smallest daily rise in new infections for more than a month, but its daily death toll remains high. WHO spokeswoman Dr. Margaret Harris told a briefing in Geneva they're seeing positive signs, but there's a long way to go.
It's a mixed picture in Europe. Some of the very large outbreaks that we're seeing in Spain and Italy, we're beginning to see a slight deceleration in cases. It's going to take time, but yes, they're seeing a slowing. Other countries, we're still seeing an increase, like Turkey, like the UK. So it's a very mixed picture. And the overall world outbreak, 90% of cases are coming from Europe and the United States of America. So we're certainly not seeing the peak yet.
Dr. Margaret Harris of the WHO. Tackling the coronavirus in South Asia is a major challenge. With a population of nearly 2 billion people, many of them are refugees and many with cultures of extended families living densely together and healthcare systems that are often very weak. The Indian Prime Minister Narendra Modi has extended the national lockdown as a number of cases continues to rise. Doctors say the real scale of the outbreak is not yet known because of how little the country has been testing so far. The BBC's Yogita Limai reports from Mumbai.
Every day, more and more Indians are losing their lives to coronavirus. The infection has begun spreading at a rapid rate. But many on the front line of the battle against COVID-19 say the statistics do not reflect the reality. I spoke to one doctor at a Mumbai state-run hospital. He didn't want to be named, fearing reprisal from the government.
Do you think we are getting a real sense of the coronavirus outbreak in India right now?
No, not really, because the number of cases that we're seeing every day and the number of deaths that we've been having, the official numbers don't reflect the same. So the other day, 6 patients with ARDS, which is acute respiratory distress syndrome, they were brought in dead. We didn't even test them, even though there was a very high suspicion that they might have had COVID. Now, even the relatives were not tested. They were just asked to practice home quarantine.
In the past week, India changed its testing strategy to combat community transmission of the disease. In simple terms, this is when the source of the infection in a person can't be traced. But many health workers say this needed to have been done weeks ago. India's testing rates are among the lowest in the world, and chronic underspending on healthcare infrastructure has resulted in a large shortage of doctors, hospitals, medical equipment and staff. The country imposed a lockdown earlier than many Western nations and has now extended it to help it cope. But for millions of daily wage earners, more weeks of no jobs and no money seem impossible to bear. In the western city of Surat, their patience broke down. Dozens of migrant workers stranded amidst the lockdown set handcarts and car tyres on fire, demanding they be allowed to return to their villages.
Yukita Lamai reporting. The Chilean government is to release hundreds of prisoners sentenced for low-level crimes who are vulnerable to the coronavirus. Around 1,300 prisoners will be allowed to serve their sentences under house arrest. Turkey's chronically overcrowded prisons are an obvious breeding ground for the coronavirus, and now a law has been passed to release up to 90,000 inmates. However, politicians, journalists and critics jailed after the failed coup 4 years ago are not included. The BBC's Orla Gurin reports.
There was a huge crackdown after the failed coup attempt here, and tens of thousands of people were rounded up, and many of them remain in prison to this day. Now, we have confirmation from the Justice Ministry that there is an outbreak in the prisons in Turkey and 3 prisoners have died. But in addition to that, the authorities have told us that about 80 prison staff have tested positive. So what the authorities are planning to do is release, we're expecting about 90,000 prisoners. Half of them will be released early, half of them will be released temporarily. The ones who get temporary release will be monitored. They'll be free until the end of May, but that might be extended for up to a further 4 months. Certainly the outbreak here is one of the fastest in the world. Cases have increased at a quicker rate than in Italy, in Spain, in China, in the US. The first recorded case here was on the 11th of March, and we now have, according to the latest figures, 1,300 dead, 61,000 positive cases.
Guerin reporting. UNICEF is concerned measles outbreaks may occur as a result of the pandemic because some vaccination programs are having to be delayed. The UN organisation says 117 million children in 37 countries may not get immunised on time. There have been several large outbreaks in countries across Europe where the MMR vaccine uptake has been low. UNICEF is calling on leaders to intensify efforts to track unvaccinated children so that the most vulnerable populations can be provided with vaccines as soon as is possible. Voting is underway in parliamentary elections in South Korea. The vote is taking place despite concerns the coronavirus will affect turnout. Voters must come wearing masks and stand at least 1 metre apart. They will have their temperature taken, disinfect their hands, and wear plastic gloves. The government's handling of the coronavirus outbreak has dominated all discussions during the election, eclipsing fears of a struggling economy and a number of corruption scandals involving presidential aides. South Korea has never postponed an election. Even during the Korean War in 1952, the presidential elections went ahead. Former US President Barack Obama has endorsed Joe Biden in his bid for the White House. Mr. Obama had held off supporting anyone while the Democratic Party contest was still live. He says choosing Mr. Biden to be his vice president was one of the best decisions he ever made.
Joe helped me manage H1N1 and prevent the Ebola epidemic from becoming the type of pandemic we're seeing now. He helped me restore America's standing and leadership in the world on the other threats of our time, like nuclear proliferation and climate change. Joe has the character and the experience to guide us through one of our darkest times and heal us through a long recovery. And I know he'll surround himself with good people. Experts, scientists, military officials who actually know how to run the government and care about doing a good job running the government and know how to work with our allies, and who will always put the American people's interests above their own.
Former US President Barack Obama endorsing Joe Biden. Finally, a US mother who was pregnant when she tested positive for COVID-19 has given birth to a baby girl while in a medically induced coma. Angela Primachenko was on a ventilator when doctors chose to induce labour in order to increase her odds of beating the illness and for the child's own safety. And after being removed from the ventilator, she woke up and was told she had a healthy daughter. And that is World Watch for today. Back to you, Mani.
Thanks, Annabelle, and that's Midday Report, Te Purongo o Te Pōtūtanga for today. RNZ will bring you the daily COVID-19 briefing at 1. Stay with us.
RNZ News at 1 o'clock. Kia ora, I'm Cynthia Morahan. The daily briefing at Parliament with the Director-General of Health and the Prime Minister will start shortly. Jacinda Ardern is expected to announce pay cuts for government ministers as part of their response to COVID-19. We'll cross to the briefing as soon as it begins. The US President Donald Trump says his administration will halt funding to the World Health Organization. He said the WHO had failed in its basic duty in its response to the coronavirus outbreak. He accused the UN body of mismanaging and covering up the spread of the virus after it emerged in China and said it must be held accountable. Mr. Trump has himself come under criticism at home over his handling of the outbreak. Freak waves on Wellington's south coast have left a person in hospital and forced residents to evacuate their homes. A big southerly swell is causing 6-metre-high waves to crash onto the road between Breaker Bay and Ofido Bay. 5 properties have been evacuated. One person had to be rescued after being swept out to sea and is now in a moderate condition in hospital. A 19-year-old man will appear in court after stealing 2 police cars and taking them on joyrides of more than 100 kilometres. The police say the man, who was wanted for previous offending, was arrested in Hastings just before midnight and placed in the back of a police car in handcuffs. But when the officer got out of the car, the offender locked the doors, climbed into the driver's seat and stole the vehicle. He was finally stopped and arrested at the Springvale Suspension Bridge on the Taihape Napier Road. But while the officer was out of the car, the offender again climbed into the driver's seat and took off. The second car was spiked at Taimohau Junction soon after, forcing the man to flee on foot before being arrested. The police say both the arresting officers had their car keys in their possession, and the man will appear in the Hastings District Court today. The former Labour MP, John Tamahere, has been appointed as co-leader of the Māori Party. He will lead the party alongside Debbie Ngarewa-Packer. The party has been rebuilding after its defeat at the 2017 election, when then co-leaders Te Ururoa Flavel and Marama Fox both lost their seats. Mr Tamahere, who heads the Waipareda Trust and campaigned unsuccessfully for the Auckland mayoralty last year, will stand against the Labour incumbent Peeni Hanare in Tamaki Makaurau. Ms Ngarewa-Packer, who's known for being at the forefront of seabed mining protests in Taranaki, will stand in the Taihauraru seat. Business New Zealand says tax breaks will not help all companies survive the coronavirus crisis. Small and medium-sized enterprises will get $3.2 billion worth of tax breaks, as well as law changes that will ease pressure on those struggling to pay commercial rents. Business New Zealand's Chief Executive Kirk Hope says it may not be enough to give all companies the confidence they need. He says small grants may be an effective way of pushing money through the economy in the next few months. Tourism industry leaders and operators are expected to find out more about plans to shake up the future of their sector this afternoon. Last week, Tourism Minister Kelvin Davis announced plans to review the way tourism is governed, marketed and how visitors are managed while becoming more sustainable. Tourism New Zealand will host an online seminar featuring Mr Davis and Air New Zealand this afternoon. Close to 2,000 industry leaders and operators have registered for the announcement. The session will also cover plans for Tourism New Zealand to lead domestic marketing during the recovery phase. Tributes are being paid to the screenwriter, playwright and political commentator Dean Parker, who has died suddenly at the age of 72. He's known for co-writing the big screen comedy Came a Hot Friday and for plays including Midnight in Moscow and Baghdad Baby. His friend Paul Tolich says he was a prolific scriptwriter and a lifelong socialist. Mr Tolich paid tribute to Mr Parker as a man of many parts who was involved in everything from the trade union movement to running cabarets. He says his friend will be missed by those in the arts, film and theatre for his writing and reviews, in the labour movement and as a loyal friend. That's the news.
I'm Indira Stewart, host of RNZ's Coronavirus podcast. Our goal is to give you all the key information around COVID-19 in 20 minutes. We're here to answer your questions and tell your stories, like this one.
We do consider both the Tooth Fairy and the Easter Bunny to be essential workers.
Find us on the series and podcast page at rnz.co.nz.
Now the forecast from Met Service to midnight tomorrow, Northland to Whanganui, including Coromandel in the central high country. A few showers more frequent for a time around midday tomorrow. Manawatu and Kapiti cloud this evening, showers from late tomorrow morning, clearing this evening. Bay of Plenty, Gisborne, Hawke's Bay, Wairarapa and Wellington, mainly fine. Brief scattered showers tomorrow afternoon or evening. And we cross now to the Beehive.
Cases is 20, and this comprises 6 new confirmed cases and 14 probable cases. There are no further deaths to report. We now have 728 reported cases of people who have recovered from COVID-19 infection. That's an increase of 100 on yesterday. And the new combined total of confirmed and probable cases in New Zealand, Aotearoa, is 1,386. Today there are 13 people in hospital, and this includes 3 in ICU, 1 each in Middlemore, Dunedin and North Shore hospitals. 2 of these folk in North Shore and Dunedin are in a critical condition. Yesterday there were 2,100 COVID-19 tests processed, with a rolling 7-day average now of 2,761, and the total number of tests completed is 66,499. I spoke last evening with District Health Board CEOs about the message I had conveyed to them around the need for us to increase testing following the Easter break. They're all very aware of this and are actively working with their teams to increase testing, including the use of mobile testing in some places to reach specific communities and groups. There are now 16 significant COVID-19 clusters. That's 1 more than yesterday. The new cluster is in Auckland and again is connected to an aged residential care facility. A reminder that a significant cluster is where there are 10 or more cases of COVID-19 that are connected. We'll provide more details on that and other clusters on our website. I just also want to point out, when you see our update on clusters, you will notice there has been an increase in the number of cases associated with clusters. Actually a higher number than the total number of new cases today. And this is because cases that were previously identified as not knowing what the origin was have now been associated with those clusters, and therefore that is reducing the number of cases for which we don't know where they have come from, and this is good. Also, just the 15th cluster we talked about yesterday, which is also linked to an aged residential care facility. That was named yesterday by that facility itself, St Margaret Rest Home in Te Atatū in Auckland. That facility is working very closely with the DHB to contain the spread, as our other aged residential care facilities do. It's not an outbreak that is confined to that facility. It has some people inside the facility and some in the community. I want to briefly update some further analysis I commissioned around healthcare workers who have been infected with COVID-19. We will update the figures on our website today, and the total number is 115, which is 8% of total confirmed and probable cases. What I can say from that analysis is that there are only a small number, less than 5, where we can confirm that the cause of the infection was that the worker was infected by the patient they were caring for. So, for example, 22% of the healthcare worker cases because of overseas travel. They had in fact been overseas recently. Furthermore, from yesterday's total, which was 107, I wanted to know how many had been infected outside the workplace, and that was because they might have travelled overseas or they were part of a community-based cluster. And the answer to that was 56. So over half of those healthcare workers have actually been infected because of travel, or they're a close contact of a case outside the workplace or part of a cluster outside of the workplace. I wanted to know how many had been infected in the course of their work, and the total there was 46. And 39 of those are in aged residential care facilities and are part of the extant clusters we have there. In just 5 instances, it was not immediately clear and hasn't been worked out where the infection has come from. I think what all this means is, pleasingly, there is only a relatively small number of cases involving healthcare workers that are due to transmission from a patient or a resident, in the case of ARC, to the worker. And in the majority of those transmissions or clusters inside healthcare settings, more staff have been infected than patients. So I'm requesting ongoing reporting and breakdowns of this data, and I think what it does show overall that there's been a huge amount of work across the system to ensure staff are protected. That includes access to and appropriate use of PPE and very good infection prevention control, and I want to commend the efforts of all those involved. That's all I have. Over to you, there, Prime Minister.
Thank you, Dr. Bloomfield. Today, I can confirm that myself, government ministers and public service chief executives will take a 20% pay cut for the next 6 months, as we acknowledge New Zealanders who are reliant on wage subsidies, taking pay cuts and losing their jobs as a result of COVID-19's global pandemic. We feel acutely the struggle that many New Zealanders are facing, and so too do the people that I work with on a daily basis. And while it in itself won't shift the government's overall fiscal position, it is about leadership. And I acknowledge my colleagues, both in the executive, but also the colleagues we work with in the public service for the decision that was taken today. But it also stands alongside many actions taken by many people, private sector, citizens, to tackle the health and economic challenges of COVID-19, including the more than $23 billion economic package, including the wage subsidy, which has paid out over $9 billion to 1.5 million New Zealanders, which MSD have worked tirelessly to make sure was reaching the people who needed it the most. Neighbours looking out for one another, rent freezers and landlords who are supporting tenants, things like the winter energy payment and benefits that are helping those who are on restricted incomes to keep warmer and well, New Zealanders who are staying home to save lives, the student army delivering groceries to over 65s, and Ministry of Health officials in charge of mandatory quarantine, for which I've received a message about their professionalism and exceptional work. So many examples of people showing what others mean to them and doing their bit in our united fight to stamp out COVID-19 and showing a little bit of kindness along the way. If there were ever a time to close the gap between groups of people across New Zealand in different positions, it is now. Of course, many people in our public sector are our frontline essential workers, nurses, police, healthcare professionals. We are not suggesting pay cuts here, and nor would New Zealanders find that appropriate. Rather, I am responsible for the executive branch, myself and ministers. This is where we can take action, and that is why we have. I'm happy to take your questions.
What details can you give us about the media rescue package and when that might be coming out?
It will be considered shortly by ministers. What I do want to just really signal early on is that there will be more than one tranche. There are things that we want to do with some immediacy, but there is some longer term work that will be at a different scale to that first tranche that will be further down the track. We are working on fairly tight timeframes though, because we do see the issues facing the media now. Ministers have been in contact with outlets to discuss with them their relative position to make sure that we're not doing anything too late to be able to play a role in the ongoing journalism that we require right now.
Will this fast track the merger between RNZ or TVNZ or have any impact on that timetable?
No, we see those, when it comes to public service broadcasting, that I see as a different space that is feeling obviously different pressures than what we're seeing from those who have received or seen a reduction to the scale that we have, of course, of commercial advertising. TVNZ is slightly different, of course, but they also are in a different boat when it comes to the role of government and the relationship there with TVNZ. But no, these are things that we are seeing as separate packages to the work we're already doing around increasing and supporting public sector broadcasting.
Can I ask about the minister's pay and then a follow-up on the media package as well?
Public service broadcasting, I should say.
What about, why not send a directive to the Remuneration Authority to have a pay cut across the board for all MPs, and what about your Labour backbenchers?
Yeah, so the mechanism that we will use, this is an in-principle decision around ministers and chief executives. We'll then work through the way that will be enacted for the legislation. Of course, because you're right to point out the Remuneration Authority and the legislation that underpins that authority is the way that we would need to make this happen. The one thing to keep in mind, though, is that that group covers a wide range of individuals, including the likes of the judiciary, and there are different rules that can apply around changes that can be made there. So it's not a simple matter of making these changes on behalf of everyone, and nor is that something we're able to do. We've made a decision about ourselves. I absolutely accept that this is not going to change the government books, but for us it was about leadership. A lot of people are taking a huge hit right now. I do not want the people who feel it to be the people on the front line, our lower middle income earners. It should be about leadership, and that means the people at the top.
Concerns raised by...
How did you reach the 20% figure?
And ultimately, this was, this is something that we just had to make a determination of where it should sit. We felt 20% was the right place. I know that some people, however, are in a position of not having work. So in many ways, this was always just going to be an acknowledgement of the hit that all New Zealanders are taking right now. Many New Zealanders are taking right now. But we settled on 20%, just being an acknowledgement that we could make as leaders.
One of the concerns that was raised...
Sorry, was it?
One of the concerns that was raised by the chiefs of the major independent media organisations today at committee was the amount of money that the government is spending on social media advertising. How much money is the government spending on social media advertising versus local media platforms, and will you redirect that advertising spend?
You're right to point out that we do both. Any New Zealander right now would see, for instance, a significant amount of advertising on our TV channels for the Unite COVID-19 messaging. But while I don't have the social media figures in front of me, what I would say is we do need to be present where people are. And so that means that we are behaving in the same way that many private enterprises are. There is advertising on those social media platforms, but that has not been at the expense of advertising in those traditional platforms that we've utilised in the past.
Promulgation of fake news and misleading information on some of those social media platforms. One of the chiefs this morning pointed out that the government's effectively, I'm paraphrasing, but propping up these social media platforms that are behaving in a way that isn't as ethical as traditional media platforms do.
All the more reason for us to make sure that there are trusted sources of information on those platforms. Whether we like it or not, it's where the public are, and we need to make sure that we access them. Separate again is the issue of making sure that journalism can survive in that new environment. We can't stem the tide of people's new behaviour. What we can do is ensure that journalism survives in spite of that.
How sizable
I'll come to Henry in the front. And then to you.
The death in Invercargill, we understand it was a man who was in self-isolation who had been diagnosed with COVID-19. Why is he not being counted as one of the deaths?
Yes, I am aware of that death, and we are seeking further information at the moment, and until I have full information, we're not in a position to confirm the cause of death of that man, and it's still, if we're confident it is from COVID-19, and this would be the first death in the community from COVID-19, we will classify it as a death, but I'm just waiting further information to be able to confirm the cause of death.
There will be more deaths at home, or are you hoping that most of them will be in the hospital?
Look, it's hard to say, really. We do have most of our people with active infection are at home in self-isolation. Only a small proportion are in hospital.
I just come back to the media stuff.
Yep.
So how would you characterise the package when you're talking about there going to be different tranches of it?
Yeah.
What's your message to commercial media who, the message was very clear this morning, they're in a very, very perilous situation?
Yes, and as we've really heard, exacerbated by COVID-19 rather than as a result of it. I think what we will be coming out with won't come as a surprise to some of those outlets, because we are in conversation with them around what is necessary for us, again, not to create a false environment where some of the new realities don't exist, but to ensure that we still have robust journalism and access to information for the public. First Trance is that which is really focused on some immediate responses, and then not too far down the track, I'd say some weeks later, we will then have a second tranche.
Are you in the position where you might look at overriding some of those ComCom decisions? Are we in a space where some of those past positions might now change?
Again, I want to act with caution about getting ahead of too much of what we might say in the future. But again, just what we will be saying, I don't think will come as too much of a surprise, because there is a good degree of communication, in spite of the fact that it's a competitive environment between our Minister for Broadcasting and those outlets.
Prime Minister, the New Zealand Māori Council has urged the government to work more with Māori businesses and industry to develop a Māori-specific employment and business growth approach. What do you make of that?
I have no hesitation to say that that's exactly the kind of thing we can and should be doing. As I touched on a little bit yesterday, whilst we've been taking a bit of a sector approach, what do we do to make sure that we're supporting the new future of tourism, our arts and cultural sector in particular? How do we support them in these new environments? I also see that for Māori, the Māori economy, that we should be also engaging directly on how do we make sure that in those areas where there's been challenges, we're addressing them, but where there's opportunities, we make the most of it as well, particularly food production.
And when it comes to growing the Māori economy post-lockdown, who will be leading that from the government's perspective? Will it be the relevant ministers, or will the Māori caucus play that more central
Our
role?
Māori caucus always has input into these issues, without question, but we also use our ministers who have some lead in particular areas, so I'd expect that for something specific there, Minister Mahuta would be involved, but at a regional economic development level, we've also been using Minister Jones and Minister Twyford, but our Māori caucus are very much on the ground, giving us the feedback about what will work in their communities, and they play an active, important role. I'll come back to Tugger and then back to Henry.
Dr. Bloomfield, you said yesterday that you'd look into concerns by nurses at Burwood Hospital's COVID-19 ward that they didn't have feet or hair covers. So can you give the New Zealand public a categorical assurance that nursing staff on that ward will always have the full kit, including foot and hair covers, and if they don't, what's your plan?
So what I can give a categorical assurance about is that we have got a really good process for ensuring we have supply of PPE out to our health sector. And that's our job as the Ministry of Health. I think we've gripped that up. We've got good stocks of PPE. We have nationalised the distribution out to DHBs to ensure they're getting enough. What I'm not in a position to do is to be able to provide an assurance about access of individual health workers to PPE in individual circumstances, because we have over 100,000 health workers. What I can also say is that any health worker that has a concern about access to or use of PPE is able to and should escalate their concerns within their organisation. There are very good processes for them to do that. The unions have ability to support that escalation process, and I know for a fact that any chief executive would take any concerns seriously and look into them. So that's the assurance I can provide.
There's mounting international evidence as well saying that wider use of masks are key to helping reduce the risk of spread because many people are asymptomatic. An advisor to the World Health Organization has stated, I think that wearing a mask is equally effective or more effective
benefit than not, and so we'll keep an open mind about the evidence.
Does the ministry know how coronavirus got into St Margaret's Rest Home?
I don't have the information about that as yet, but what I can say is that some of the cases are outside the rest home and some are inside. And what we have seen with all of our aged residential care facility outbreaks is that they have been introduced by someone coming in from the outside, whether it's a worker or earlier on a visitor. And so the way that it was introduced may well have been because someone who was in the rest home also was infected out and is part of that community-based part of the cluster.
Would you be concerned if it was a staff member who brought it in, or would that make sense as something that happened?
Well, we're concerned about it, whatever the cause, we're concerned about it, and we're most concerned about finding out how it got in and, of course, stopping any further spread. And just to go back to my earlier comment, that all of our facilities working incredibly closely with the local public health units and DHBs to stop that further spread.
I'll just put Joe on the front.
Just back on PPE, Dr. Bloomfield. Should nurses be reusing masks, goggles, visors? Understand that that's been recommended by the Ministry of Health, but the WHO says that they should only be reused when there's a shortage, which I understand we don't have.
I think there's a distinction between recycling and reusing, and there is some work that's looking at, that we're not sponsoring, but there is some work looking at whether you can clean and reuse PPE. And I agree with the WHO, you should only do that if you have a shortage, which we don't. I think there's a distinction between that and using PPE for a period of time. For example, our nurses who might be doing swabbing in CBACs don't need to change their PPE between each patient they might be swabbing, so they will be using it for a period, and the important thing is to change it after a period of time, particularly the masks, because they get damp and they need to be disposed of.
So nurses should be getting very clear information from their DHB about when it is appropriate and when it's not to be reusing or recycling it.
Well, I wouldn't expect they would be reusing or recycling it. There may be some elements of the PPE that you could use for a longer period of time than others.
Just come down the back.
You may not have the exact numbers on this, but of cases in recent days, how many of these are infections in new bubbles as opposed to sort of cases in an extant cluster or spread within a bubble from one infected person? Do you have an idea of like how many of these are in new bubbles?
Majority today are cluster related, as I understand. I believe the vast majority. Sorry, we might come back to you on the breakdown. Do you want it over a couple of days or just for today?
Just a sense of, in recent days, is the virus still spreading between bubbles and within the community, or has it been clamped down on?
Yeah, my recollection is 5 or less for most of these different days that we've had on reporting of cases, and then with a bit more time, some. Investigatory work.
That's right, Prime Minister. And so what we're doing at the moment is working our way back to look at every new case since the 1st of April to determine that they have either all been linked to an existing cluster or a close contact of a case or overseas travel. And so far what we've found, and I think that's why you're seeing the proportion of unexplained cause, which is right from the start, has gone from 11 to 10%, which represents another 13 cases or so that have where they have found the source and been able to attribute it to an existing cluster and case. So we're working our way backwards, and we will also be examining every case every day now by the end of the day to find out exactly what the source is, and if we're not sure, then to put a wide ring fence around that and really go and investigate it closely.
One of the issues of us coming down and giving you the results in such close proximity to when we receive them is that we don't always have that final information when we give them to you. I'll come in the front.
Dr. Bloomfield, can you tell us where Dr. Burrell's contact tracing report is and when we get it?
Yes, it's with me and my team who've worked up, and I just response to it, and we're furiously responding to the recommendations, work underway. The plan is to put that in front of ministers in the next 24 hours, yes, tomorrow. And once they've had a chance to look at it, then we'll make it public, as well as some information about what we're doing. This morning, actually just in particular to confirm with him about the arrangements he's got for his staff to go in to make sure they are well protected, and I was very satisfied with the arrangements he's put in place. Obviously, his findings, I would like to inform our work and also make sure that whatever he finds and what we find from our review is used to continue to strengthen and improve our, the protection for staff and residents within our aged residential care facilities.
Yep. Okay, Ben. For the first time, recovered cases is now outnumbering the number of people currently suffering with the disease. That feels significant.
Yes.
I imagine that will stay the case as well, given we've got a smaller amount of new cases.
Yes.
So does that actually mean anything in terms of the health system? Can you now downscale the apparatus you've built to deal with
that's actually
in any way? Or?
Probably more a question for the Director General.
And the question was, can we downscale the...
What does it mean for you in terms of the actual fighting of the disease? Anything, or is it just a number?
Well, it really reflects that we've had a much smaller number of cases over the last 2 weeks, recalling that recovered cases are people for whom the symptom onset was at least 10 days ago and they've had no symptoms for at least 48 hours. So it just really reflects that the bulk of our cases were in that February-March period, and they're now being classified as recovered. What I would say, though, is that fundamental to our work now and over coming weeks and months will be having ongoing, very rigorous testing and very timely follow-up and contact tracing. So we're not downscaling, and if anything, we're sort of identifying and filling in any gaps in those processes to make sure they're gold standard.
Could it be that the health system is currently experiencing the bulk now, and it will only get easier?
Well, I think it is experiencing the bulk of the current, peak that we had, and we're past that peak, but not out of the woods. Yes, there will be, I think, less pressure now on the health system over coming weeks. But of course, what we need to do is ensure the health system can essentially revert to providing as much care as possible for people while still maintaining its ability to respond to any COVID-19 cases.
Sorry, someone who's had their rent hiked?
Yeah, a business owner who's had their rent raised says this morning's announcement was a token gesture. It's not addressed the issue at all, and asking landlords to do the right thing has done nothing. Why did you not implement a rent freeze for commercial properties?
Because we couldn't. So the Residential Tenancy Act gives us different abilities that the Property Act does not. But what we wanted to do was create the same kind of additional buffer that we have for those in residential properties by saying that essentially the ability to remove a tenant, really widening that from a 10-day to a 30-day, and again clearly send the message here, be a good citizen. You know, it is just utterly unfathomable in this situation to see some of what we've seen, including increases in commercial rents at a time like this. I'd also just ask someone to think about what happens if you then do remove someone from your commercial property. Who is going to tenant that in the middle of level 4, let alone any other level right now? So take a long view, work with your tenant, and actually just be a good human being.
Dr. Bloomfield, did the Ministry of Health provide any advice to ministers or other government departments on what the public health effects might be under the various scenarios that Treasury presented?
The scenarios presented yesterday. So we didn't provide any specific advice, but our advice is obviously informing action right across government around, in particular, preparing for stepping out of level 4 down to level 3. And a public health view of that would be, yes, we would want to do that very quickly because we want to get the economy going again and ensure people have employment, income, access to education and so on.
Okay.
There are many New Zealanders in immigration detention in Australia, and the Human Rights Commission there have said that all those should be released just because it's a COVID-19 hotspot. Have you got any concerns about that, and have you talked to Scott Morrison about those issues?
Look, I haven't spoken to him specifically about that issue, but again, that is entirely within the mandate and the management of the Australian government. It's not an issue that we have any direct control over. My expectation is that obviously within the Australian government they'll be working hard to make sure that COVID is contained in all of its environments, just in the same way that New Zealand is.
In terms of the Pacific community, are you confident that you are capturing the full rate of infection or not in the community if most of the positive cases are they still related to the Marist cluster, or are the infections elsewhere in the Pacific community?
Yeah. In terms of numbers, 62 individuals who identify as being Pacifica have had COVID-19, and so that is amongst the lowest of the ethnicities that we are breaking down and as part of our reporting. What I can't tell you is what percentage of those will have been from the Marist cluster, but I imagine a number would have.
Yes, a good number, and one of the things we're also looking for, of course, is the rate of lab and I said yesterday we were doing another extract of the lab data. It came in later yesterday, so we're just analysing that, but we'll provide that today, and we'll be looking for high rates of testing and low positivity rates.
Given the low numbers among Pacifica, which on face value is a really good thing, does that though give confidence that you are picking up the true rates of infection? Is there anything that would give you any concerns about that?
It gives me some confidence, and I'd like to get a high degree of confidence with the increased testing this week in for example, South Auckland, to make sure we're getting good rates of testing amongst Pacific communities there.
Yeah, right at the back.
Dr. Bloomfield, just to
Oh, sorry, just right at the back, and then I'll continue.
Have you been in touch with any of the families who've lost a loved one as a result of COVID-19?
No, I haven't. I mean, most families are, the byline around respecting privacy. Time, I imagine that is something that I'll look to do, but I have really tried to just give them the distance and the space I really wanted a time like this. Yeah.
Bloomfield, just to clarify, you're part of that group taking 20% pay cut?
Yes, definitely.
And what I should add is, just before coming down here, I did advise the Leader of the Opposition of the decision that had been made by ministers, which of course chief executives were already obviously aware of that offer and decision as well. They were a part of that. I made it known to him, and he has indicated that he will be joining in this initiative as well. Yeah, just at the very back. Yeah, I'll come back to you.
Trump's decision to suspend funding for the World Health Organization.
Oh, sorry, was that for me or? Yes. Look, my view and the view of New Zealand and those, of course, who engage directly with the World Health Organization, incredibly important body. At a time like this, where we need to be sharing information, where we need to have advice that we can rely on, the World Health Organization has provided that, and we will continue to support it, and we will continue to make our contribution. Perhaps Dr. Bloomfield may like to comment as someone who had a close association with the World Health Organization.
Just to reiterate the point you made, I think the global response to this pandemic will require a strong World Health Organization, so it behoves all of us, I think, and New Zealand, I know, will continue to play its part supporting the organisation actively, both globally and also in our region and across the Pacific.
Prime Minister, thank you. First for Dr. Bloomfield, how far back does the stag do cluster date back to, and is that cluster linked to a prominent New Zealander?
I have to say I don't know on the first case, and I have no idea on the second.
What's your advice to parents that have sat down to homeschool their children for the first time today?
Oh, well, I've actually been getting a little bit of wider family feedback, and actually from others who have been watching as their children have been perhaps engaging in the broadcast that has been put out in 2 free-to-air channels today. The one thing I would really say is don't put too much pressure on yourselves as parents to be teachers. Yes, I absolutely appreciate that you're the ones facilitating that, and there's quite a burden that comes with that. But as Nigel Ladder has said, your kids will be having more of an educational experience than you probably appreciate right now. These are extraordinary times. Don't be too hard on yourselves. They will be learning, even when you may not notice it.
The cash cry that you kind of issued, go hard and go early, was used to help get us into level 4. What's your approach for New Zealand coming out of level 4?
Well, obviously that's not a decision we've yet taken, so I guess my catch cry now would just be let's stay the course. We are doing things differently to others, and we're seeing results that are different to others. Now, very few countries have got their numbers down as low as we have, so there's few to learn from at this point, other than ourselves. So I would really encourage New Zealanders, we don't need to constantly compare to other places. We'll do it our way.
But will level 3 look this time round compared to what it did 3 weeks ago, those 2 days that we were in?
It was obviously it was brief. We've got very broad parameters that people already see in the public domain. Tomorrow we'll be giving a lot more detail around that, but it will still require us to continue to reduce down our contact with one another. Yeah, Joe.
You mentioned in your opening remarks because people have moved out of that unknown category. What is that unknown category at now? Is it reducing by a lot, and is it taking quite a bit of time to contact trace those people in particular?
So the proportion that is unknown is down to 10%. So just over a week ago it was 18% of cases. But that's 10% of all cases right from the start. And what I'm really interested in is in the ones that have happened in the last 2 weeks and that happen over this coming week, what are the proportion that where it's unknown and we can't link them to existing clusters and cases. So I think it's that proportion that is the most relevant, and as soon as I've got some data on that I will share that.
So in terms of that 10% though, are there some cases in there that it has been so long now that you just may never actually be able to?
Correct.
But I think that it's a good point to make, differentiating for those cases that were, for instance, well over 2 weeks ago versus those that are in the last 2 weeks, because lockdown helps us reduce down the chances of transmission of those unknowns elsewhere. But if we have it in these last 2 weeks, that's what we really need to pay attention to. I believe that of the 20 cases today, 19 of them have been linked to clusters, as I understand. So that gives you a sense that those numbers are smaller now, but important nonetheless.
So there's some scientists in New Zealand.
Come back in the front. Yep.
There's some scientists in New Zealand who are working or want to work on a cure for COVID-19, and they would like some government help on this. What is your message to them? Is this something you would invest in, some sort of local?
My understanding is that Health is actually working with the WHO and the Health Research Council on responses to COVID. I'll let Dr. Bloomfield respond to that.
So just a quick comment. The Health Research Council has done a call for proposals, and I understand that they'll be making announcements later this week on the research that has met their requirements and that they will be funding.
Do you have any concerns that New Zealand will be quite far down on the pecking order when it comes to vaccines?
I'm not concerned about it because we will make sure we're not. And I think there are a couple of ways we can do that, but predominantly that will be making sure we are working here, which is undertaking research. There may be some vaccine research that we can also do here, and I think we will look to work really closely with Australia around research, development, and then production of a vaccine.
We've been talking about surveillance testing or sentinel testing for weeks now. We've sort of actually seen that program being rolled out. How far away is it, and why is it taking so long?
Well, I'd say we're doing it now. The testing we're doing now is effectively population-wide sentinel testing, and that includes wide testing, having a low threshold for testing, and specific efforts to target groups, and for example through mobile testing going out and to find cases. So arguably, in my view, is at the moment we are now doing what I would call population-wide, across the country, sentinel testing. So if you think about yesterday's confirmed number of 7 cases and 2,100 tests done, it's a positivity rate of under 0.3%. So effectively we are testing to find any case out there, which is sentinel testing.
You're not going to launch a formal program of sentinel testing, just sort of kind of widen your own.
There will be, once we move down into level 3, there will be some ongoing testing, which again, some of which will be sentinel testing and some of which will be specific case finding or cluster management, which is part of our overall surveillance, which includes documenting influenza-like illness calls to Healthline, visits to general practice for influenza-like illness. There is the app, the flu tracker, which interestingly, and again we saw this yesterday, is also happening in Australia. The prevalence of people with influenza-like symptoms has dropped off through all those surveillance mechanisms that we have over the last week or two.
Dr. Bloomfield, perhaps you could help me with my recollection as well. Yesterday when I asked the same question about sentinel testing, my recollection is that it numbers in the hundreds. Sentinel testing, whereas obviously the scale.
Usually each year, Prime Minister, there's 270 tests a week done for influenza, and we're doing, well, yesterday 2,100 tests for people with any respiratory symptoms.
Yeah. Okay. Oh, just a last couple, yeah.
Just to clarify the point around the Media Select Committee this morning, is the government considering redirecting that advertising away from those global platforms like Facebook and Google?
we will continue to advertise in places where New Zealanders are. We still have an obligation, for instance, through campaigns like the one we've run on COVID-19, to actually be where New Zealanders are accessing news and information. But we are also advertising on those more traditional platforms as well, and we will continue with that. Advertising and this way that government uses advertising is part of our wider consideration, but it doesn't mean that we won't continue to be in places where Kiwis are.
Sorry, Jane? What about political advertising? Isn't that a different thing? It doesn't have the public good aspect, and should that continue to be put through?
Political advertising will be a decision made by individual parties, and so that will really be a matter for them. Obviously, in those cases, politicians will often just be a part of the community as well, so it has a different lens to it.
Do you see any merit in President Trump's reasons for suspending WHO funding? He basically said that they were being too kind to China and had kind of stopped people doing travel bans early enough.
No.
I know you were like to dig a bite with a response, the 5G, the WAC 5G conspiracy the other day, but given that people are now destroying telecommunications towers, what message would
Use
you
for 4G.
What message would you like to send to those who are promulgating that conspiracy theory?
Don't.
Dr. A question.
Maybe I'll just leave it to the facial expressions of Dr. Bloomfield. Okay, we'll take a last question down the back.
For Dr. Bloomfield and the Prime Minister, if you'd like, what do you make of the idea that's sort of been disseminated yesterday and in recent weeks that the virus isn't as bad as people are saying it is because it will largely only kill people who would have been likely to die anyways?
Firstly, say that to someone who's lost a loved one. In fact, that's probably the only thing I'll say on that.
Two comments on this. First, I think just yesterday, WHO Director General Tedros talked about how much worse this virus is than the swine flu virus. I think he said 10 times worse than the virus that caused the pandemic in 2009. And secondly, the deaths we've seen around the world are not confined to older people and people with pre-existing conditions. In fact, we have seen younger adults who are otherwise perfectly healthy die from this virus. They are not immune, and I think that's been a really clear message from those who have had much greater outbreaks in their countries, is to try and get that message out. So this is a tricky virus. It's by no means not a problem in younger people, and therefore it behoves all of us to do everything we can, not just to protect our older people and those with pre-existing conditions, but actually to stop unnecessary deaths across our population.
Okay, thank you everyone.